intensive care units at Sunshine Hospital and Footscray Hospital at Western Health are both open plan. There's no individual negative pressure rooms or single bed area rooms, and healthcare workers were at huge risk of being exposed to COVID-19 virus in the air. So under the direction of Associate Professor Forbes McGain and in combination with some engineers from Melbourne University, we developed a ventilation hood.
The problem with COVID-19 is not really a problem of lack of ventilators, for example, it's a lack of nurses. And if nurses feel unsafe about coming to work, they won't, and then the whole healthcare system tends to fall apart. So very early on, I realised that was going to be the issue. I was actually running around the park with my daughter long ago with a pram and thinking about how we could have a pram-type device that would protect the patient and protect the nursing staff as well. This has been a story of collaboration, working with the University of Melbourne Mechanical Engineering team, Western Health's intensive care unit, and CSIRO aerosol scientists.
We got a phone call from Forbes McGain from Western Health saying we really need some help with the hospitals, and we had no experience in working with medtech or hospitals or infectious diseases certainly, but we did know a lot about fluid mechanics, which is the movement of air. We knew that we didn't have to fully isolate the patient from the rest of the ward. We believed we could do it by just sucking air past the patient through this fan. It is then pushed through a HEPA filter, which essentially takes out all the infectious disease particles from the air. So we came up with a prototype and we took that straight into the hospital. And as soon as we met up with all the nurses, they all came around and gave us all this just incredible feedback.
We gave suggestions, we tweaked a few things, sent it back. They brought the next prototype back for us to re-review.
There were many iterations of that prototype, up to probably about 6 or 7. And now it's standard use in many hospitals, particularly in Sydney and Melbourne. We've had interest from overseas. I see this being also used very much so in the treatment of TB and other airborne spreads.
Benefits are immeasurable, and I can tell you I've been approached by a number of nurses to say how pivotal having the hood in our environment has been at making them feel much safer from droplet and aerosol exposure. The collaboration to work with those teams was absolutely amazing. I can't thank them enough.
It's been an incredible privilege to be involved in this project.
It's a really concrete example of people working together to try and make it better for healthcare workers and other patients as well.